This is the audience for Amber Rhodes' persuasive speech. 1, 2, 3, 4, and 5.
Hello, my name is Amber Rhodes, and I'm going to be giving my persuasive speech on vaccination. Imagine you're sitting in the waiting room of your doctor's office. The child across from you is running a fever, has sores on their body, and is vomiting. What's your first thought? If you and your child have been vaccinated, you're in a lower risk of getting any of the contagious diseases. I'm in the child care industry, and thanks for having been vaccinated, I'm able to avoid all of the illnesses that are passed around. I'm going to explain the importance of being vaccinated to prevent you and your family from serious illness or death. Immunization is defined in the New World Dictionary of American English as to give immunity to as by inoculation. I'm sure that some of you are by now wondering what some of the available vaccinations are and what exactly they'll protect you from. The polio vaccine was originally introduced to the public in 1955. Its introduction decreased the polio epidemic from 20,000 cases to no reported cases in the last 20 years within the United States, according to the Center for Disease Control. The rubella immunization is another one that is very well known. It's usually given at the same time as the vaccination for measles and mumps. The Children's Hospital of Philadelphia states that before this vaccine, parents could expect that at least 20,000 newborns would be mentally retarded or have birth defects. So what exactly do immunizations prevent? The polio vaccine is most known for preventing paralysis. Rubella vaccines prevent birth defects and mental retardation in the fetus of pregnant women. According to the New World Dictionary, it also prevents swollen glands and small red spots on the skin. The diphtheria vaccine prevents serious breathing problems, heart failure, paralysis, and even death, according to the Immunization Action Coalition. The most common side effects caused by immunizations, according to Maria Carter, LPN, are as follows. The main symptoms are rashes or respiratory distress. Other symptoms are fever, swelling, redness at the injection site. These are all normal symptoms. If these symptoms do not get any better or worse, it's likely they will get better over time. After explaining some of the different immunizations, we are now going to take a look at the positive aspects of vaccines. Some of the upsides of vaccines are decreased illness, disability, and death. According to immunization.org, reported cases of the measles dropped from 500,000 to 44 cases per year. Polio has not affected anyone in the United States in the last 20 years. Consequently, there have been no paralyzed cases due to this disease. Vaccinations also decrease the amount of time home from children from school and parents from work. Children who have not been immunized are usually made to stay at home when there's an outbreak. They usually don't catch this disease. If children are sick, parents have to stay home with them, so then they miss work. Vaccinations also decrease the amount of infection spread to others. Unvaccinated people pass disease to others who are unable to be immunized due to medical reasons. Those people that have not been vaccinated stand a smaller chance of infecting babies who are too young to be fully immunized or those children whose immunizations did not take. We will now look at the possible complications from immunizations. So what are some of the downfalls of immunizations? The first is mercury. The CDC states that if the recommended level of mercury is exceeded, brain damage, mental retardation, blindness, seizures, and nervous and digestive problems can occur. Thimerosal is another preservative used in vaccines, which poses possible complications. As of today, only 2 vaccines still contain thimerosal. Finally, anaphylactic shock is another complication of vaccines. According to Maria Carter, anaphylactic shock is a main worry of immunizations, although it is not common. If a patient is allergic to any of the components in vaccines, they cannot get the inoculation. Hopefully, all the information I've presented today will help you to make a more informed decision about immunizations. The purpose of my speech is to explain the importance of being vaccinated to prevent you and your family from serious illness or death. I've tried to explain the importance of vaccines and what the lack of them will cause. The Immunization Act Coalition best states it this way: your final decision affects not only the health of your child, but also the rest of your family, the health of your child's friends, their families, classmates, neighbors, and your community. Thank you.